Chronic pain and catastrophization. Hello, I'm Wertli MM, and I would like to take a few minutes to summarize this paper or literature review. Influence of catastrophizing on treatment outcome in patients with nonspecific low back pain. Over 85% of adults experience some low back pain in their lifetime. But of those, about 10% go on to develop a disabling condition we refer to as chronic low back pain. However, the individuals in this 10% account for 3/4 of the cost of medical care and lost productivity associated with low back pain. Many studies have investigated the risk factors associated with the 10% who simply don't get better. There's now strong evidence that negative beliefs about low back pain lead to catastrophizing, in which patients imagine the worst possible outcome. This fear leads to avoidance of activities, which further worsens low back pain, a vicious cycle. Where there is pain, which leads to greater fear and catastrophization, which leads to increased avoidance of movement, which leads to greater pain. The findings of this review suggest that high catastrophizing scores are associated with more pain and disability at follow-up. In surgical patients, catastrophizing has been associated with more post-surgical pain and poor quality of life. Regrettably, catastrophization is often further magnified by easy access to inaccurate online information, sending patients down the awful Google rabbit hole. Healthcare professionals not taking the time to explain the benign nature of various common radiological findings, such as degenerative disc disease, herniations, osteophytes, etc. Hence, I've developed a poster called Concerned About Your X-ray or MRI Findings, Medical Imaging, The Untold Truth. This poster was also referred to as the vomit poster, preventing people from becoming a vomit or a victim of medical imaging technology. Regrettably, catastrophization is often further magnified by healthcare professionals, offering patients non-evidence-based false explanations for their pain, such as degenerative disc disease, benign disc bulges, misalignments. Patients sensing that they're being unheard, dismissed, and brushed off by the healthcare system. The good news is that studies also show that it's possible to break out of this cycle of pain, fear, and catastrophization, and avoidance of movement. A decrease in catastrophizing during treatment is associated with better outcomes. So, what can we as healthcare providers do to minimize the development and the potential negative impact of catastrophization? 1. Spend sufficient time with patients to ensure that they feel heard. 2. Explain the benign nature of most radiological findings. This poster is available free for downloading and to print on APTEI.ca under Pain Education. 3. Avoid non-evidence-based explanations for pain that only further contribute to catastrophization, such as misalignments, trigger points, aging, posture, you name it. To minimize catastrophization, one may offer patients alternative non-catastrophic explanations for persistent pain. Have them visit thepaintruth.org and view the introductory videos. Thank you for joining me.